Lurie Children's Facebook Live today. We are joined by Dr. Stuart Berger. He's the Executive Director of Lurie Children's Heart Center. We thought it would be a great opportunity to sit down with him, being that it's National Heart Health Awareness Month, to talk about how exactly the heart works and functions in our bodies. During the broadcast, if you have questions, please submit them in the comments below, and we'll have Dr. Berger answer them live. With that, we'll get started. Thank you again for joining us.
Thank you, Julie. It's great to be here.
Yeah, this will be fun. So we have our heart model here. How does the heart, or what's the purpose of the heart in the body?
Well, the heart functions primarily to deliver nutrients and oxygen to the tissues. It has to pump blood, and within the blood, oxygen is carried. Other important things in the blood is carried, but primarily it has to deliver oxygen to the organs, all the vital organs, because the organs require that blood flow and that oxygen in order to work. So oxygen delivery to the tissues is probably one of the most important functions of the heart.
Okay. And is the heart a muscle or an organ?
Well, I think it's both. I mean, there are things in the body like liver, kidney, heart. They're all considered organs. Mm-hmm. That just means it's part of the body and a functioning part of the body, but it's also a muscle. The heart is a muscle. It's different than the muscles in your arms or your legs. The myocardium, which is a cardiac muscle, is different, but it is also a muscle.
How is it different than from the other muscles in your body?
It's just a different structure, how it's made up, and the microscopic structure of the heart muscle, the myocardium, is different. The skeletal muscle is striated muscle. It contracts and it allows you to move and actions, where the heart is a different muscle from a structural standpoint.
So going more into the muscle, is it the heart a stronger muscle? Because when you're working out, say, those types of muscles throughout your body get more fatigued. Is the heart muscle built differently?
It's different. It's built differently so that the muscle getting fatigued in the arms and the legs versus the heart, it's a different discussion altogether. So they're very different.
Okay. So where does the heart sit in our body?
Typically, in most people, but not all, it sits within the left chest. So where I'm putting my hand right now, to the left of the sternum is where the heart sits, sort of points in that direction. But there are a subset of patients, and kids in particular, who may have their heart in a different place. It could be in the middle, it could be over to the right, but the majority of us have our hearts in the left chest.
Okay. And I know growing up, I always heard you make a fist, that's probably the relative size of your heart. Is that accurate?
I think that's a fairly good accuracy. And of course, there's going to be a wide range. Some people have larger hearts.
Right. More
often than not when there's a problem with the heart. But in general, I think for any size of any body, that's a general guideline.
And it grows with you as
absolutely
infancy to adulthood.
Absolutely.
Okay. So we have our heart here. Can we go through how the heart is constructed?
Sure.
What are we looking at here?
Well, if you look here, the heart, and you don't see it, it's not obvious from this, but the heart consists of 4 chambers. And I think I'm going to take this apart a little bit just so we can see inside the heart. And the normal structure of the heart, and so what you see here is this is the right side of the heart. This is a sort of a barrier in between. It's called the ventricular septum, which separates the right heart, at least the right ventricle, from the left ventricle. And the way the heart works is that the veins return all the blood from the body into the heart. And in general, veins bring back blood to the heart. So here's one vein that returns all the blood from the upper body. I can take that apart. This is the upper receiving chamber, the right atrium. There's a little valve here. This is the tricuspid valve. My thumb is in there. And the blood returns from the tricuspid valve to the right ventricle. And this is all blood that does not have oxygen in it. This is blood that comes back from the body because the oxygen has been used up by the tissues. And so then this blood gets pumped out here, and my finger now is in the pulmonary artery. This is the pulmonary artery here. And the pulmonary artery then carries blood into the lungs. One lung here, one lung here. The lungs are not on this picture. And then the lungs provide oxygen to the blood. So from there, you can't quite see it, but I'm going to turn it around. These blood vessels bring back blood from the lungs that have now received oxygen into the left atrium. The left atrium is up in here, and then it returns blood through this valve, it's called the mitral valve, into the left ventricle. And the left ventricle is the main pumping chamber of the heart. If I tip this up here, this is the aortic valve. which leads to the aorta. And this blood now, which again, remember, has oxygen in it, gets pumped into the aorta and then out to the body to all the vital organs. To the liver, to the kidneys, to the brain, through these blood vessels, where again it delivers oxygen and the whole cycle starts again. The tissues use the oxygen, send it back through the superior vena cava, the inferior vena cava, which we don't quite see here, and this happens over and over and over and over again. And that's how the heart works for the most part, in a very simplified form and discussion.
So you started with the discussion of the septum divides the heart, really. There's 4 chambers, but the septum divides it into 2 sides.
Correct.
Can we touch more on, it seems like each side has a different role, and what those roles are?
As I said from the previous discussion, the right side is the receiving chamber of the heart, so all the venous blood, all the blood that is blue that comes back from the body comes to the right heart, the receiving chamber, the right atrium, the pumping chamber, the right ventricle, then it gets pumped to the lungs to receive oxygen, and it comes back to the left side of the heart, where now the left side of the heart's function is to take that blood that's got oxygen in it and pump it to the rest of the body.
Okay. And then you mentioned the aorta. That's, I think, artery a lot of people have heard before.
Yes.
How important is that artery?
Well, it's critical. The aorta carries the blood from the heart out to the rest of the body. So this big red blood vessel carries the blood to the brain, and here's the blood vessels that it takes to the brain, carries the blood, you don't see it, down to the lower body, the kidneys and the liver. So we couldn't live without an aorta. Blood flow into an aorta of some sort is critical to supply that oxygen and blood flow to the rest of the body.
And what exactly is the artery? An artery?
Well, it's a conduit, it's a blood vessel, and it depends upon the size and where it goes, but an artery, by definition, carries blood away from the heart to somewhere else. In this case, this is the carotid artery, so it carries blood to the brain. In this case, this is the aorta, which carries the blood flow to the other arteries. If you look further down, you'd have arteries that carry blood flow to the kidneys. So by definition, an artery carries away, for the most part, oxygenated blood that has oxygen in it, to the other organs, so that those other organs can indeed get the oxygen and blood flow that they need.
And how many arteries do we have?
We have a lot, and it varies.
Oh, okay.
It varies with patients and what's going on. Some of these arteries are together, some of them are apart, but we actually have a lot of arteries that supply all the vital organs.
Okay. If anyone has any questions, as a reminder, please submit them during our broadcast. We have Dr. Berger, who's the Executive Director of Lurie Children's Heart Center, with us today, and we're discussing how the heart works. Okay, so when a heart beats, we all know it has a sound. At least we can hear it when a doctor is listening to your heart. What exactly makes that heart beat?
Well, the heart beats because of the electrical system. You know, not only do you have all these chambers which get blood flow, but there's an electrical system within the heart which allows the heart to beat in a very structured, normal fashion. So you can't see it here in the picture, but up here, somewhere around where the superior vena cava is in the right atrium, there's a structure called the sinoatrial node, and that's where the heartbeat starts. And this very intricate electrical system then sends these electrical pathways all through the heart, into the atrium, into the ventricle, and on both sides of the heart. So normally what happens in a normal situation is the beat starts up in here, it starts the atrium to beat, then that beat goes down to something called the AV node, which is literally located between the atrium and the ventricles, and once the atrium contracts and allow blood flow to flow into the ventricles, then the ventricle contracts and allows blood flow to go out either to the pulmonary artery or to the aorta. But this is a separate system from the blood vessels. This is the electrical system, which really allows the ventricles, the atrium and the ventricles to contract in a very concerted fashion. You asked the question, Julie, about the heart sounds. Mm-hmm. The heart sounds are not caused by the electricity, but the heart sounds are literally caused by the valves closing within the heart. Okay. And those valves close only in response to where the blood flows and how the blood flow gets to them. So once the blood flow gets into here and goes out into the pulmonary artery, the pulmonary valve closes and that causes a sound. Once the blood flow goes back into the aorta, same thing, you hear the different sounds. So the sounds are related to how the valves close, and that's all very interrelated to both the electrical system as well as to how the chambers open and close and how the valves open and close.
And we have 2 valves on either side of the heart?
We have 4 valves.
Four for
Yeah.
each.
2 inflow valves, the tricuspid valve and the mitral valve on the right and the left heart side respectively, and then 2 outflow valves, the pulmonary valve which goes to the pulmonary artery, and as we saw under here, the aortic valve which goes out into the aorta. So 2 valves that come in and 2 that allow blood flow to come in, and 2 valves that allow blood flow to go out.
So it's the valves that produce the sound of the heart.
Exactly.
And the valves also, so when there's a heart murmur, that sound can be a little varied, right?
A heart murmur simply means that there's a sound other than the closure sounds of the heart. Normally when you hear the heart, you listen to a heartbeat, you hear what the so-called lub-dub, which is the valves closing. But if you have a heart murmur, you typically hear a noise in between the lub and the dub. And depending upon where you hear it, what it sounds like, the condition, you can tend to make a diagnosis of what the reason for the heart murmur is.
Okay. Again, if you have questions, please submit them. We're live with Dr. Berger. Let's talk about the Heart Center here at Lurie Children's.
Sure.
We're ranked 11th in the nation by U.S. News and World Report. What type of patients do we treat at the Heart Center?
Well, we see all patients with congenital heart disease or even some patients with acquired heart disease. This is different than an adult heart center where they primarily see patients who have myocardial problems, myocardial infarction, or blood flow problems to the coronary arteries. But we see everybody with any form of congenital heart disease, whether it's holes in the heart, some of the chambers being malformed, kids who've had surgery, kids who need surgery. We even see adults who've had congenital heart disease because, as you know, kids are now growing into adulthood with congenital heart disease. So that group of patients is a group of patients now that we follow closely, not only from birth, in fact, from the time that they're in fetus, all the way to infancy, childhood, and adulthood. So we see any patients at any age with congenital heart disease, and that population of patients is continuing to grow.
That's right. So even fetal patients, correct? Because I know around the 20-week mark during a pregnancy, a lot of times congenital heart defects are discovered or heart conditions for the fetus. So you'll start seeing patients as early as
20 weeks of pregnancy or earlier. Yeah. Some of the patients that are diagnosed by some of our colleagues in maternal fetal medicine will be sent to us, some of the moms, for consultation, where we'll do an echocardiogram if they found an abnormality of concern, and we'll help with the diagnosis and help counsel the families with regard to next steps and get them into the Heart Center fairly early. They know what to expect, and we're prepared and they're prepared for everything that's going to occur after birth.
Right. Okay. We have a question. How am I supposed to say that? Mitral?
Can I read it?
Yeah, go ahead. You probably can say it a lot better than I can.
If mitral valve prolapse is stable throughout your life into adulthood, does it indicate that it will not be an issue in the future? I think the answer to that is probably yes, but it depends. I think it's something that has to be followed very closely, because along with mitral valve prolapse, you can also have mitral valve insufficiency. And so that's the reason it has to be followed very closely to make sure the mitral insufficiency is stable. But for the most part, if it's just mitral valve prolapse and the patients are doing well and the mitral valve insufficiency is stable and doesn't need intervention, more likely than not, things should be okay, but it has to be followed.
Does that mean that that valve just doesn't work properly? Where is it on the heart?
The mitral valve is here, and it means that part of the valve prolapses back or pushes back into the left atrium. And in some cases, it could be associated with mitral insufficiency or a leaky valve.
Okay.
So for the most part, if that leaky valve is there and it's mild and it doesn't progress, then it would just be followed and nothing needs to be done. But it has to be continually followed because there's such a wide variation of that.
Okay. And for those of our viewers that are just starting to watch the broadcast, we like to kind of go back and do a refresher since it is live. So let's start over and talk about how the heart is constructed. You mentioned it's 4 chambers. And I'll let you take it from there.
So 4 chambers. The function of the heart is to pump blood out to the body. The way it does that is the blood comes back from the body through this vein. There's another equivalent vein that comes back from the lower body. We don't see it here. Brings blood to the right atrium, which is the receiving chamber, sends blood to the right ventricle, which pumps blood to the lungs. Oxygen is put into the blood in the lungs, comes back to the left heart via the left atrium. You can see it back here. then to the left ventricle, and then pumped out to the body.
Okay. And we have another question.
I'll read it again.
Yeah.
My daughter has a mitral valve stenosis that they have replaced twice. How many times can those valves be replaced? Well, I think the answer is they can be replaced as many times as they need to be replaced.
Okay.
Typically, the valves, when they're put in, are put in over a period of time because the valve is mechanical and doesn't grow with the child. At some point, the children will outgrow the valve.
Mm-hmm.
So at some point in life, it wouldn't be inconceivable that once or twice the valve will be outgrown and a larger valve has to be put in. When you get to adulthood or adolescence, the hope would be that you could put a valve in that would be an adult-sized valve, and then you wouldn't need to do it again. But the answer to the question is it can be done as many times as it needs to be done. You know, if the kids outgrow it or there's a problem with the valve, it can be done. And obviously it's an open heart operation, but it can be done as often as is necessary. There isn't a limit to the number of times in general.
Okay. And before we start talking about how the heart works again, we were speaking about Lurie Children's Heart Center. Lurie Children's is our heart center is also part of Briggston Cardiac Care Unit, and that's an inpatient unit within the hospital. Tell me why it's such a unique unit.
It's really an amazing unit. It is a 36-bed unit at Lurie Children's Hospital, about to go up to a 44-bed unit. It's a very unique unit. We have a model called an acuity adaptable model, and what that means is in that unit, all patients who have cardiac disease go to the unit, whether they are post-operative and need intense critical care, or whether they're coming in, whether they're recovering from surgery, or whether they're there just to watch and observe over a period of time. The acuity adaptable part of it means that no matter how sick or how well the kids are, they're in that unit and they're cared for by a specific team, that they don't have to move somewhere else. The team gets to know them, they get to know the team, and it's a very unique model that works very, very well. I think other centers are beginning to learn from us and are considering doing this, but it's a great concept, and the continuity and the connection with the nurses and the docs is very important.
You mentioned we do care for very critically ill patients, but we also have a preventive cardiology clinic.
Yes.
Tell me more about that.
We are very blessed to have a group of people who do preventive cardiology, and when I mean preventive cardiology, taking care of kids with hypertension, hyperlipidemia, the high cholesterols and the familial high cholesterols, kids who are overweight, and not many pediatric heart centers have that, but we have a whole group of people who do that and do that very well. Our biggest problem is that we've done it so well and we're so busy. We need to get more kids in because it's such an important part in this world in the United States. We have a great collaboration with the folks over at Northwestern who are really leaders in this field. So it's another unique niche that Lurie Children's Hospital and the Heart Center in particular has, and it's something that I think is going to be really a huge benefit to the community. Already is.
Right, in that clinic, the preventive clinic is available to patients not just at the Lurie Children's main hospital downtown, but at our outpatient centers.
Correct.
There's also cardiology services in different suburbs, so you can find out more information on where we serve different communities at luriechildrens.org/heart. Going back to the preventative cardiology piece, how can someone keep their heart healthy?
Well, I think diet is important. You want to have a heart-healthy diet and make sure you're careful about fats and salts and cholesterol. I think exercise is also very important. I think especially kids who may tend to be more sedentary these days, need to get out and walk and run and do other aerobic type stuff. And I think it's always important to make sure people understand that smoking is a bad thing. Obviously substance abuse is a bad thing. I think all of those are very important parts to teach kids and families in this day and age with regard to preventive cardiology, and I think that will help keep their heart healthy.
You mentioned cholesterol. What exactly does cholesterol do to the heart? High cholesterol.
Well, cholesterol has an important function. We need cholesterol for growth and development of organs, and certainly growth and development of the brain, especially when kids are young. But if it's high, one of the places that cholesterol can end up are in the coronary arteries, which I think we might be able to see here. These are the arteries that supply blood to the heart muscle itself.
Those look like veins.
Nope, they're
but
arteries.
That's an artery.
Yeah.
Okay.
And if you get cholesterol in these blood vessels, and get a significant amount of cholesterol, it can block the blood flow to the blood vessels, and then it can hurt the heart muscle. This is the reason, one of the more important reasons for myocardial infarction.
Okay.
So high cholesterol can do that, and I think particularly...
That sounds like a fancy term. What exactly is that?
Is a myocardial infarction?
Yeah.
It's a heart attack. It's a heart attack. Thank you for pointing that out. And so if you have cholesterol, not good cholesterol that ends up, ending up in these blood vessels, you can end up with a myocardial infarction, and that obviously is a very, very important problem and sometimes difficult to take care of.
Is that the same reason why stroke might happen?
Exactly.
Okay.
And stroke would be something that could happen in these blood vessels. The blood vessels, they're bigger than these, but it can still be possible. These are the blood vessels that supply the brain.
Right, okay. We have a question. So my son has a heart murmur. Does he need to do anything special?
Well, he should probably have it checked out by his pediatrician, and his pediatrician should then decide if it needs to be checked out by a cardiologist. A heart murmur is nothing other than an extra sound that you hear when you listen to the heart. The majority of heart murmurs in kids are what we call innocent murmurs or functional murmurs, meaning it's just from the blood flowing around in the heart. But some of the heart murmurs could be from abnormal things related to the heart, either holes in the heart, abnormal valves, and so if it's an innocent murmur, then nothing else needs to be done. But if it's not an innocent murmur, then something needs to be done and it may need to be followed. So it's important to diagnose what the cause of the heart murmur is.
Right, and heart murmurs stem mostly from the valves, right?
Correct.
The sounds.
Blood flow across the valves, or you can actually have holes in the heart.
Okay.
Holes in the ventricular septum, which are congenital cardiac abnormalities, and they cause murmurs also. So it would be important in the person's son, the person who asked the question, to make sure that there's an understanding of why the murmur is there.
Right. And we actually have an infographic that we posted, I believe, a couple days ago or yesterday on heart murmurs that provide more information. So as a reference, you can find that on our Facebook page. I actually was born with an innocent heart murmur, but
it's very common.
Yeah.
A large number of kids have it, but they tend to be outgrown. But it's important to make sure that one knows if it's an innocent murmur versus a murmur from an abnormality. That would be important to know.
More serious, right?
Exactly.
So let's talk about the Regenstein Cardiac Care Unit again.
Okay.
It's 36 beds, and tell me again why that's so unique.
Well, it's unique because it's what we call an adaptable, acuity adaptable unit, meaning that every single cardiac patient in this institution goes into that unit, and what they need is adapted for how sick they are. They could be post-op patients after heart surgery. They could be patients who are just coming in for overnight observation for an abnormal heartbeat. But they go to one unit. It's the same nurses that know them and take care of them all the time. It's the same physicians. And that's unique. That continuity of care is fairly unique because at many other centers, there's 3 or 4 different units, 3 or 4 different nursing staffs, and kids have to go back and forth. This continuity and being in one place at one time, I think is a real benefit.
And a lot of these patients are, like you said, patients that we probably see from birth into adulthood.
Yeah, exactly.
And one of those reasons is because of congenital heart defects.
Correct.
They're pretty common. I think they are the most common birth defect.
Most common birth defect, for sure.
And is that the majority of patients you'd say we see in the heart center?
Yes, the majority of patients are kids with congenital heart disease, kids with arrhythmias, which are abnormal heartbeats, but those are usually related to congenital heart disease. Almost all the kids down there have that. We see on occasion other kids who have other forms of cardiac disease. We call them acquired cardiac disease. They could get Kawasaki syndrome, a rheumatic fever, or things like that, but that's relatively less common.
And congenital means present at birth.
Exactly.
So most likely it was diagnosed during the mom's pregnancy,
or
but
shortly after birth. Yeah, congenital by definition is an abnormality that you're born with. For many of these, if not most, we don't know why they occur.
So it's not necessarily a hereditary?
Not necessarily. It can be.
It can be.
Some conditions can be.
Okay.
Like hypertrophic cardiomyopathy, long QT syndrome. They do run in families. But most of the forms of congenital heart disease, and we'll get better at it, I think as time goes by, we don't know why they occur. They're probably a combination of some environmental influence, maybe some genetic influence, something hereditary. But for the most part, we really don't know why.
Interesting. We have another question. Why do transplants only last so long?
Well, that's a great question, and there are a lot of potential complications after transplant, most of which are controlled very well, but one of the long-term complications that can occur is what we call graft atherosclerosis, that over time, for whatever reason, these blood vessels that supply the heart get narrowed and maybe even get some plaque in them. And then what can happen for a subset of patients over time, and this is only one reason that they don't last, there are other reasons, is that these blood vessels then compromise the blood supply of the heart. And that we think that's a form of chronic rejection, but nonetheless is something that we have to deal with. There are other reasons that heart transplants don't last forever, including the possibility of getting other forms of rejection. For the most part, we think we can get through many, many years, and there are some patients who have certainly gotten through 10, 20 years, and retransplantation is not unheard of. But I think there are long-term complications related to a lot of things that we don't understand. Some of them are the medicines. I think we still don't understand this graft atherosclerosis thing, but I think there are at least several reasons that that's the case. I'm hoping as time goes by, we will learn more and more about these things. We'll be able to prevent these things, and that maybe hearts can last even longer than they do.
And we're heart center transplants.
Yeah, we have a very active, busy heart transplant team.
The only one in Illinois.
Correct.
One of the largest in the nation.
We did 20 last year,
wow.
and we're a busy program, and the therapy is an excellent therapy for kids. So,
we have another question. Salting heavily is part of the protocol for maintaining POTS. I might need you to clarify what POTS is first. But will I be at higher risk for high salt diet issues? So let's start with what exactly POTS is.
POTS is a very interesting entity. It's some degree of autonomic dysfunction. What I mean by that, and we don't quite understand that also, but what I mean by that is autonomic dysfunction means that there's some issue with how the neurologic system supports the heart, supports the heartbeat, and supports the heart rate. And kids who have POTS can have abnormalities in heart rate. They can be dizzy. They can pass out.
I'm going to stop you, sorry. What's the normal heart rate?
It varies.
Okay.
It depends on the age.
So for a child in teen, adolescent years?
It probably, I would say the normal heart rate's from maybe about 50 to 80.
And I know as an infant, because I had a baby, it was always around 100.
Correct.
Right?
It's much higher.
Right.
And POTS is an unusual thing in infants. It's more of an entity in older children and adolescents. But it has to do with a variation in heart rate, a variation in how the blood vessels dilate. A lot of the kids who get POTS get dizzy, they pass out, they feel miserable when they get their fast heart rate and the variation in heart rate. So there's a lot of different therapies for POTS. There's a lot of different variations on POTS. And one of the therapies is salt, making sure that you have a lot of fluid on board, you have a lot of salt on board, because the salt will maintain the fluid. And I think the answer to the question is that I think long term it's not going to be an issue, and I'm hoping that for the majority of patients with POTS, they don't have to be on salt intake over a long period of time. But we got to get them through the POTS symptoms and the syndrome. So to answer the person's question, in the short term and probably in the medium, even in the medium term, salt intake really should not be an issue.
Salt intake, though, for someone who doesn't have POTS, how does that affect the heart?
Well, we wouldn't recommend it. I mean, salt in moderation is not a bad thing. You can't have no salt, and to think you should never have salt, that doesn't make sense.
Right.
We certainly would recommend not having a ton of salt, and I think if you have congestive heart failure, having salt or a lot of salt is a bad idea. But for young hearts that work well, which is usually the case in POTS, again, it's an autonomic problem, not primarily a heart problem. Taking salt to maintain fluid in the blood is not a bad thing. I don't think there's big long-term consequences.
Okay. We have another question. My 9-year-old son suffers from VSD. We'll have to have you clarify that. Is there a way to treat this condition?
Well, the VSD is a hole within the ventricular septum, a
Okay.
ventricular septal defect, and there is a way to treat the condition, but I think it depends. There are some kids who have small VSDs who never need anything done other than to be followed, and if they have small VSDs and it's not causing a problem, I wouldn't do anything other than follow it. Kids who have big VSDs have other problems, and they may need an intervention. Some of those kids need surgery, Some of those kids need to be on medications to keep things under control. So the answer to that question depends. It depends upon where the VSD is, the size of the VSD, and if it's very small, there's a lot of kids walking around with VSDs who never need anything. So I think in order to answer the question, more information would be necessary.
Okay. We talked about cholesterol, but not blood pressure yet. So when someone has high blood pressure, what exactly is going on in the heart?
Well, it depends also. It depends on what the cause of high blood pressure is. But the garden variety forms of high blood pressure, which we call essential hypertension, meaning that there's no underlying cause, it just means that the blood vessels are a bit more constricted, causing a higher blood pressure. In the short term, that's not a problem. In the long term, it could cause problems. It can cause stroke. It can cause problems with the heart itself. It can cause the heart to thicken and have more problems pumping. So you wouldn't want something like that to go on for a long, long time. And it's less common in kids. It's certainly more common in adults. But if it's something that can't be treated, can't be made better easily, some of those kids need medications. And sometimes just a better diet, better exercise, or more exercise may be all that's necessary to treat it. But again, it depends on the severity and how it responds to that kind of therapy.
Okay. I don't know if anyone else has questions, but we might be wrapping up here with Dr. Berger. Do you have anything to add?
No, it's a pleasure to do this, and you know, we would hope we would do it again, and maybe people will have more specific questions. And I look forward to meeting with you and the team, and with anybody who may have questions for us.
Yeah, thank you. This was great. We hope you guys enjoyed it. If you have questions post-broadcast, you can always submit them in the comment section, and we can work on getting you some answers from Dr. Berger at a later time. Thanks for joining.